A desperate mother put her trust in a state system she thought would save her son. It didn't. Now, in a lawsuit, she's demanding answers. What went wrong inside the mental health center where the 19-year-old died? CBS News Chicago investigator Dorothy Tucker reveals exclusive photos and documents that provide troubling clues. And we need to warn you now, the details of how this young man died by suicide may be disturbing.
Madden Mental Health Center.
Hey, Ma.
Patient, Anthony Stringfellow Jr. His last call.
I love you.
That day I wasn't even supposed to work.
Tuesday, February 7th, 2023.
I was called in by my manager, a nursing manager, to come in because they were short-staffed once again.
Rod Kadashan, mental health technician. A trainee, less than 6 months on the job.
I believe first time I met Anthony and he was just walking around and I said, is there anything I can help you with?
Anthony was just 19 years old.
He said, well, you wouldn't understand.
Admissions report. Patient was attempting to jump out second floor window.
No one understands. No one can help me.
Mental status, paranoid, depressed, irritable being here. Pavilion 6.
It was me and Candace with, I can't remember how many patients. I believe we had 11 or 12 apiece, so Candace was assigned to Anthony.
Dinner time. Anthony was a no-show.
So she goes to find Anthony and she yells out, "Rod, help!" She screamed it several times, just sobbing and crying.
Room 103. Photo, the day of the suicide.
He was actually right here. He was against the wall.
That's his shoe, lying on the ground.
Anthony is sitting with a rope, well, string around his neck, and the middle door hinge, he tied it and he hung himself.
So you tried to save Anthony's life?
That's correct. I'm doing chest compressions. I'm counting to 30. And I'm thinking to myself, if this was my son, I wouldn't quit. I couldn't quit. I'm not gonna quit on him. And I told Anthony that I'm not gonna quit.
5:22 p.m. Broadview Ambulance 7 was dispatched to Madden. Patient unresponsive. 15 minutes later, Loyola's ER. Patient pulseless on arrival. Medical examiner's report, cause of death, hanging. Manner of death, suicide.
Come here, let me get up here so I can use it.
Tell me about Anthony.
Anthony was awesome. He loved his family. He loved life.
Athena Webster signed the papers to admit her son to Madden.
We didn't know what to do. But he was just so depressed and he couldn't see any way around it.
Anthony was only supposed to be here 7 to 14 days. Because he was admitted on a Saturday, Webster had to wait until visiting hours the following Tuesday. Only the visit never happened.
We talked about 3:30 and he said, "Y'all coming up here, right? You coming up here? You said today you coming, right?" "Yes, baby, our appointment is at 7:30.
Anthony called back at 4:18 p.m. Mom missed it. He left his last message.
I love you. I love you. I love you. I love you.
I hate that I relied on them to help our family, to help my son.
So what happened to Anthony Stringfellow Jr.? CBS News Chicago reviewed medical reports, police reports, state investigations. What we found? Directives, policies, and procedures that should have been followed were not. Let's go back to the day Anthony was admitted. His suicide risk was moderate. The order called for frequent observations, which meant
we're assigned a certain amount of patients that we have to do head counts for every 15 minutes.
Every 15 minutes, the box was checked, but it didn't happen. Broadview Fire EMTs were the first on the scene. Someone on the staff told officers the patient was last seen during dinner time, 15 minutes prior to calling 911. But according to Rod, that was not true.
His food tray was actually on the table.
State investigators interviewed Candace Burbridge, who was assigned to Anthony. The report read, from 4:30 to 5, Burbridge conducted 3 15-minute suicide checks. At 5 o'clock, Burbridge documented the patient was in his room. At 5:13, the patient was unresponsive. But investigators checked the video at the facility. It contradicted her story. Burbridge failed to conduct the last 2 15-minute checks. Burbridge told investigators she was instructed by a supervisor to falsify the records. Her excuse for the failure? She lost track of time while completing other work-related duties.
That if those 15-minute checks, at least every 15 minutes, were performed the way that they were supposed to, Anthony would, one, either still be here or they would have caught the act soon enough where his life would have been spared.
The 15-minute check failure isn't the only issue Attorney Trish Hudson raises.
The string that he used, that's a prohibited item. How did that get there?
According to guidelines used in the state's suicide prevention plan, any material that can be looped or tied must be removed. The string in Anthony's case was a shoelace.
Initially, when a patient comes in, we check all their belongings and remove all the strings, and we really don't know to this day how he obtained that string.
Another issue, this door hinge. Anthony tied the shoelace around the tip. The state basically says door hinges should be removed or altered so patients can't use them to harm themselves. In state terminology, it's called an anti-ligature plan. We exclusively obtained more than 400 pages of emails and documents sent to and from the director of Madden around the time of Anthony's death. These are just some of them. They showed an urgent push to find out how Madden was implementing the state's plan to prevent suicides. January 23rd, 2 weeks before Anthony's death. Subject, anti-ligatures. 2:23 p.m. One state director writes, we need to gather a list of current anti-ligature needs. 2:39, another repeats. Can you pull together a list of anti-lig needs? 2:59, Madden responds. Requested data will be gathered. Only it's not.
It's sad. The whole situation is sad.
2 days after Anthony's death, a flurry of emails, starting with this one from the state director to Madden. Circling back, I don't think I ever received the requested data.
How did that implementation fail? Why were the ligatures still there? We have a lot of questions. A lot of questions.
You 1 or 2 reasons I'm not out on the streets. Mama, I promise I'll pass the test and be better than the rest.
You gonna remember my son's name?
I love you too much to explain. You can make the sun shine on the rainiest day.
Aww. He is not a black and white sheet of paper. He's Anthony Louis Stringfellow Jr. And you gonna remember his name.
Rod Catachan, the man who tried to save Anthony's life, says he lost his job immediately after that. The Illinois Department of Human Services says the other tech on duty who missed the 15-minute checks is still in the process of being terminated 2 years later. We aren't sure about the status of the supervisor she accused of telling her to falsify the report, but that supervisor is among those being sued by Anthony's mother. In the lawsuit, the Attorney General's office is representing her. One defense being put forward by state lawmakers reads, Anthony Stringfellow Jr. had a duty to exercise ordinary care in the maintenance of his own life and had an obligation to maintain his own life. About that, the AG's office says the office does not comment on pending cases. Chris.
So many questions here, Dorothy. What is happening with the anti-ligature work at Madden?
Now, we did check with the state. They say Pavilion 6, where Anthony died, is now closed and the anti-ligature renovation work is underway. If you or someone you know is facing a mental health crisis, call 988. Last year, the Suicide Crisis Lifeline handled nearly 6.5 million calls, texts, and chats
from people needing help.
And so many questions still outstanding. You'll stay on top of it as things develop.
Absolutely.
Dorothy, thank you.